Luke is autistic. He was diagnosed with autism at 19 months old, and ever since then he's been autistic, nonverbal. He was burned on January 24th. We were cooking something on the stove, and I went in the other room to get a shirt out of the bathroom, and I was in there and I started smelling something burning, and I thought it was very unusual. And I'm kind of smelling, I'm looking around, and I look down the hall and I see Luke standing there on fire. He didn't, since he can't talk, he wasn't able to communicate that there was something wrong, and he obviously doesn't feel pain the way we do, so he didn't notice and didn't realize he was on fire, and he didn't know what to do. So he just stood there letting himself burn. He burned 40% of his body with third-degree burns. He had to have 6 skin grafts. He has at least another 2 surgeries scheduled for this year.
I first met Luke at Loyola Burn Unit. I was asked to come and see him and assess him for transfer to Rabida. So I went and met with the nurses and the doctors there with Dr. Hova, and we were actually able to watch a dressing change because he had an extensive burn, and we wanted to be sure that we were able to take care of him at Rabida.
So the care of a serious burn like Luke's requires a multidisciplinary approach. We have a team of occupational physical therapists that are trying to minimize contracture formation, and then we have a psychological therapist who is dealing with this trauma experience of the burn, and then the nursing is very extensive. There's up to a 2-hour dressing change, especially when he first came over, where we're trying to minimize anxiety and pain around that dressing change without heavily sedating the patient. And so really the experience we've developed over years of caring for burn injuries like this make this a great place for rehab, and where his surgical team wanted him to come as soon as they could get him here.
Luke has made some significant changes since he has come to us at Rabida. When he first came here, he was only able to lay in his bed and he didn't move at all. Now you can see him running around the floors and outside when he goes with the therapist. And so that's a huge change, and his grandmother, who comes here very frequently, is so happy to see that some of the old Luke is coming back. When he first came here, he did not make any sounds and was only using his iPad to play. As it's gone, we've heard him become more vocal. He is still nonverbal, which is where he was at to begin with, but it's nice to actually hear some of his sounds now, and he's able to indicate his happiness or his sadness through the intonation patterns in his voice.
The inpatient nurse's role in Luke's care is to, give him his medications in the morning, change his burn dressings, monitor his burns for any changes or infections that might be occurring, provide palliative care measures, so which means keeping him comfortable, managing his pain and his itching and keeping him comfortable through dressing changes.
Luke has been just a wonderful patient. He seems to really work hard, and he seems to pick up on anything that you give him really quickly, and he's just a joy to work with every day. I give him different activities, new activities, things he's done before, and he really just picks up on it. Like, I can give him a new puzzle to put together, and I'll show him one time how to do it. The next time he does it, he can do it by himself. He just wants more activities all the time, and I just love working with him.
So as an occupational therapist, I have been working with Luke, focusing on helping him to increase his range of motion, so how much he's able to move his arms, and also to help him work on doing the skills that he was able to do prior to his accident.
Luke's been in Rabida for approximately just over 3 months, and it's a great experience for us, as any parent would be nervous leaving their children in a hospital where they don't know and they've never heard of it before. And so having him here long enough, I realized that it's a great place for your children to be, because it's very comforting, because the staff and everyone involved takes such great care of your children, and it's a personal touch. The nurses all know what he needs and likes, and I don't have to worry.
My favorite memory of Luke is just seeing him in his room with his headphones on, kind of acting like he is really, you know, having fun with his music.
What I hope for Luke is that he can get back to school as soon as possible. His school team has been a big part of his recovery here. I'm in contact with his teachers all the time, and they love Luke and they want to see him back in school. So my goal is to keep him on track with what he was doing in school before he came to the hospital. So once he gets back to school, he will be right on track.
Hey, look, one more time, sign yourself out. My daughter. You know which one to do too. Oh, yeah. Thank you, sir. Bye. Bye. Hope it goes well. You're in here.
Hi.
Yes.
Hey.
You going home?
Yes.
Take your bag. You can open the door. Okay. Push. Bye.
I'd just like to say thank you to everyone at La Rabida. It's been, like I said, a really, really great experience, and they've made us feel very welcome, and we're very appreciative that Luke was able to be here.